Hello friends and welcome back to my YouTube channel. As you know that water is essential for life, constituting approximately 60% of adults' body weight. So water is distributed across various compartments. So why this fluid is necessary for our body? It helps to maintain body temperature and shell shape. It also helps to transport the nutrients, gases and waste products out of our body. It also helps in some biochemical reactions and facilitate nutrient transports. So if we'll see the fluid balance in male and female, if we'll compare under 18 years of age, 65% in males and 55% females. In 18 to 40, 60% and females 50%, and 40 to 60 years 50 to 60% in males and 40 to 50% in females, and over 60 50% in males and 40% in females. So here you can see percentage of water in the human body. So in first you can see the fetus. So they have the 100%, then baby at birth they will have the 75%, then normal adult 60% contains water, and elderly person 50%. Then body fluid distribution. So if we will see body fluid distribution, the fluid is present in the intracellular compartment, extracellular compartment, and some is the plasma volume. So if we will take a 70 kg of any person, they will have the 42 liters, that is the 60%, then 28 liters 40%, 14 liter that is the 20%, and 3.5 liter plasma volume. So intracellular and extracellular fluids. So if we will see here you can see the total body mass in male and females, 45% solid and 55% fluid in females, and in males 40% solids and 60% fluids, and just 60% fluid that is present in the intracellular and extracellular compartments. So what do you mean by intracellular compartments? Intracellular fluid means the fluid contained within the cells. So this approximately proportion is the 2/3 of the total body water. So here you can see this is the cells. So inside the cells the fluid is present, that is called the intracellular fluid, and outside the cells that is the extracellular. Now in extracellular also interstitial fluid comes. So interstitial means between the cells. So here you can see this is the portion, that is the fluid present in this area, that is the interstitial, and within the blood vessels is the plasma. So this is how this fluid is distributed into our body in intracellular, extracellular. In extracellular there is interstitial and the plasma volume. So that is the fluid that is present in our body and how it presents. Now how fluid balance in our body. So if we will see the desirable amount of fluid intake is equal to the loss of fluid in the normal human adult. So it range from the 1500 to 3000 ml each 24 hours. So average if we will take, that will be 2500 ml. So if we will take 2500 ml fluid, our loss will be 2500, maybe through urine, through feces, through respiration, anyway. Then normal intake should be equal to output. So if this is not maintained, there will be a balance. If intake is not equal to output, there will be imbalance in the fluid in our body. So what is fluid imbalance? When there is a changes in the extracellular fluid volume, and that can lead to the alteration in the sodium balance. Then changes in the sodium and water ratio, either hypoosmolarity and hyperosmolarity. Now what is hypoosmolarity? So hypoosmolarity, osmolarity means the concentration of the solutes in the solution. So sometimes it may be too high or sometimes it will be too less. So what is hypoosmolarity means? The condition where body fluids have a lower than normal osmolarity, means there are fewer solutes related to water. So means solutes are less and water amount is high. So it will be opposite in the hyperosmolarity. Solutes are more and water is less. So that is the difference between the hyposmolarity and the hyperosmolarity. Then fluid excess or deficit. If there is fluid excess or deficit, that can lead to the loss of fluid balance in the body. So there are some clinical conditions, some pathological changes is not of equal significance to all the people. Like you can see the example here, same viral syndrome with associated nausea and vomiting. There are two persons. So one person is having the extracellular fluid volume depletion, but they will not have any significant electrolyte disturbance. Another person is having the renal failure and he's having the life threatening electrolyte disturbance. Then fluid volume disturbance. What do you mean by it? So if there is any abnormally decreased or increased fluid volume or rapid shift from one compartment to other compartment like intracellular to extracellular, that can cause the hypovolemia and the hypervolemia. So we will discuss all these things one by one. So first we will see the hypovolemia. So as the name suggests, hypo means decrease. So what will happen in our body? There will be decrease in fluid volume. So fluid volume will be decreased. There will be loss of body fluids and compartmentalizing of body fluid. Fluid may be shifted from one compartment to the another compartment. So whenever there is a decreased fluid volume, so our body will also react. So you can see the pathophysiology here. So whenever there is a fluid volume reduce, what will happen? There will be stimulation of the thirst center. And where is the thirst center? Thirst center is in the hypothalamus. So when the hypothalamus get the signals, person will feel thirsty. So they will go and drink water. Like it happens in a normal individual. You can see also. Like when we drink water, because our brain will get up, hypothalamus will get signal, and then we will drink water. Second is the increased ADH secretions. So now ADH is the antidiuretic hormone, and this hormone is also called a vasopressin. So it is produced by the hypothalamus, a posterior pituitary gland, into the bloodstream. So what this hormone does? This hormone, what they always release when there is a reduced fluid volume in our body. So what this ADH antidiuretic hormone does? It does water retention. So what happen is it increase the water resorption in the kidney by acting on the collecting ducts and reduce the urine output. And second is that it also helps to maintain the blood pressure regulation by doing the vasoconstriction and all. But here we will be discussing related to the fluid. So how it will help? What it will act on the kidneys, stimulates the kidney for reabsorption of the water. So water will reabsorb from the collecting tube and automatically there will be reduce in the urine output. So here you can see also ADHD secretions increase, that will increase the water reabsorption from the collecting tubules, and urine output reduces, and urine specific gravity again it will increase with osmotic diuresis. Third mechanism is the renin angiotensin aldosterone system. So RAS. So it is the hormone that will help to regulate the blood pressure, fluid balances, and electrolyte levels. So renin is released from the kidneys, juxtaglomerular cells in the kidneys. So they will also help to lower the blood pressure, low sodium levels in the distal tubules. So it is an enzyme. What it does, it converts the angiotensinogen into angiotensin. Tensinogen is produced by the liver, and then this angiotensinogen is converted into the angiotensin 1 by the renin. Then this angiotensin 1 is converted into the angiotensin 2, specifically in the lungs. So this converts angiotensin into 2. So then this angiotensin 2, what it does, it does the it stimulates the aldosterone release and from the adrenal cortex, and that will helps to increase the water and sodium retention. So again, if there will be a sodium and water reabsorption from the kidneys, again it will helps to reduce the urine output, and automatically there will be increase in the fluid volume in the body. So this is how this mechanism works. So what are the clinical manifestations patient will have? What are the signs and symptoms? Patient will have the acute weight loss because fluid is going out of the body. Then oliguria patient will have, oliguria means reduce the output, or it will may be equal to 0. Then low blood pressure. Patient will have the sunken eyes, dizziness, weakness, decreased skin turgor, and concentrated urine. So how we will treat this? So for this, whenever there is a reduce in the fluid volumes, we have to give him the oral rehydration therapy. We can provide the IV fluids, dietary management we have to give. Then monitor patients, every fluid intake and output chart should be maintained, weight should be checked, vital signs, pulse. Then patient can have the orthostatic hypotension. Orthostatic hypotension means when the patient will change his position, he will her blood pressure will fall. Then urine output, concentration of the urine should be checked, and degree of oral and mucous membrane moisture should be checked, because all these things we can able to find out how much fluid loss is there. Then, to prevent hypovolemia, the nurse should identify the patients at risk and taking the measures for to minimize the fluid loss. Like if the patient is having the diarrhea, so they have to provide the oral rehydration therapy, or she can provide the this thing antidiarrheal drugs to the patient, so that he can get relief from the uh, diarrhea, and automatically if the patient will get the, because that is the underlying cause, one of the cause for fluid loss. So if patient will get this medications, it will reduce the symptoms. So this is all about the today's video, hypovolemia. Hope you liked the video. So thank you for joining us on this insightful journey. Stay curious and continue to explore the wonders of human body. Thank you so much. And if you like my videos, please like, share, and subscribe my channel.